Argentina. I'm 66 years old.
After a career in the skies for Qantas, much of Ricardo Alarcon's retirement has still been spent far from his leafy Sydney home, with a charity helping Thailand's most vulnerable orphans.
Holding the children's hand, going shopping or doing something like that, the children would pay attention to my tremor. It is like a current that goes through my arm and leg. And they used to feel that, I guess, and they used to tell me, you know, and shake their arms as well, which was very funny at the time. But yeah, it was them who picked it up before I did.
He was diagnosed with Parkinson's disease just over a year and a half ago.
It affects when I'm eating. It's a problem. I can't use my left hand very successfully. I noticed that my teeth click and is progressively getting worse. And the doctors told me that that is what's going to happen.
Today, he's one of the first Parkinson's patients to undergo breakthrough brain surgery at St Vincent's Hospital, Sydney. But first things first.
You got good hair. It's a shame to see it go, but...
I think I'll be fine because my hair grows very fast. If something goes wrong, I don't want to go and meet my maker with a bald head.
Unlike other, more invasive Parkinson's surgeries, which target symptoms like stiffness or slowness, Ricardo is about to undergo a focused ultrasound treatment to fix his shaking hand and foot.
The hope is that using the focused ultrasound we can also achieve improvement in Parkinson's disease by treating those targets with the focused ultrasound as well. And if that's the case, then that'll open this treatment up to a much broader group of patients who have Parkinson's disease.
For the more than 80,000 sufferers of Parkinson's in Australia, what's being perfected here could be a huge step forward in making their lives more bearable and calming their shaking hands and limbs. But what's really interesting is they're only treating the symptoms. There's still no known cause for Parkinson's disease.
I see it as a jigsaw puzzle with a lot of pieces, and we have no picture to guide us. But when we find small pieces that click together, we know we're making progress, and we are, just never fast enough for either us or patients.
Professor Anthony Cooper at the Garvan Institute is one of the researchers driving the Australian Parkinson's mission, which has $30 million of federal funding to seek answers.
Some of the puzzle pieces, well, we're now seeing that the immune system clearly plays a role in the disease. We're trying to understand where does that originate from. There's also the gut. Are they playing a major role or a contributory role? The genetics for, as I said, a couple of genes, that's really giving us some progress, because if we could just get our fingers on the target, like, hey, at least even for it's a small group of people, this is the start of your problem.
Parkinson's disease is actually a broad collection of debilitating symptoms, which can vary from case to case, can start early or late in life, and which progresses slowly or rapidly. Plus, many can have it long before any symptoms emerge. Using DNA sequencing and biomarkers, the Garvan Institute hopes to better assign a subtype to patients, therefore allowing clinical trials expected to begin before the end of this year to personalise specific drugs to treat that subtype of Parkinson's disease.
How are you going temperature-wise? Are you good, cold or hot?
Back at St Vincent's, Ricardo's pioneering operation is underway.
Doing a lesion here as well.
Can you do
I
that
can do it remotely, yeah.
Can you?
By creating that lesion in that part of the brain, we're going to interrupt an abnormal electrical circuit that is responsible for the patient's tremor.
So it's sort of like breaking a circuit without creating an incision.
That's exactly right. And the patient, because they're awake, they can communicate with us the entire time, so they can tell us exactly how they're going.
Taking about 2 hours, the team has finally settled on a target. It's time to shoot the restorative blow of ultrasound to a point the size of a pinhead deep inside Ricardo's awake brain.
Look at it go, he's trembling. Hey, look at that. Bang, it stopped.
Yep. 52.
Yeah, good.
So it's a good
That's
intermediate
excellent.
level, we should see.
Yeah.
When we hit that temperature of 52 degrees, which was the last sonication cycle, his rest tremor in the right foot disappeared. It went from quite a conspicuous tremor to disappearing, instantly.
Thank you.
Just see if you can
Oh
use
my
just...
goodness, it's so good. It's incredible to feel the freedom of movement again when it was all taken away 2.5 years ago.
But despite promising early signs, Ricardo's shaking returned in the days after his initial surgery.
How have you been?
I'm doing well.
Yeah?
So 3 months later, Ricardo is back again at St Vincent's Hospital. This is a pioneering
Yes.
piece of surgery, but pioneers have setbacks and
Yes.
your tremor has returned.
Yes.
How did you feel when it returned?
I was disappointed, but I didn't know. I thought maybe with time it will correct itself.
I mean, your tremor looks like it's gotten worse than when we
is.
first saw you.
It is worse.
Yeah.
Yes, yes.
Yeah, I suppose that's not something you expect when you're coming into surgery.
No,
like
I
this.
didn't expect that because it disappeared. It was totally fixed for 7 days.
Well,
So-
look, good luck today.
Thank you.
We're looking forward to seeing you on the other side and hoping for
On the other side.
a good result. Well, hopefully not that far.
It's easily spooked, I think. And I think what we did was enough to spook it on the day, but not enough to keep it away for reasons that are not entirely clear.
This time, Ricardo is in for almost 4 hours.
The tenacity in trying to do the right thing is amazing. It hasn't been perfect, because I don't think it will be, but that's the nature of the disease, I guess. So,
I'd say that this is about 80% better or something rather like that.
Yes, yeah, that's exactly how I feel.
It's a bittersweet moment for Ricardo and for those fighting against Parkinson's disease.
Anybody who tells you that every treatment they do, every operation or anything else they do is going to work 100% of the time isn't telling the truth.
It needs a little bit of help.
It's 2 steps forward and 1 step back for both treatments and research to combat this deadly disease.
In the long term, our big goal is, could we identify you before you have symptoms and give you those therapies for stopping it progressing? Because that would mean you would never advance to have symptoms. I mean, that would be, for me, a functional cure.